In this video, I'm going to discuss my journey through the ICU. My name is Christine and welcome to a new video. If this is your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss a thing. Being an ICU nurse has been an experience that was unforgettable. I've seen so much good and bad. I've seen ton of critical care, and I've seen patients at their lowest and at their highest. My experience as an ICU has guided me in my career as a CRNA. That experience gave me the stepping stone and foundations to be successful as an ICU nurse, as well as being successful as a CRNA. I still remember graduating nursing school and being so excited. I was so excited to start my journey as a nurse. I didn't know for sure what I was going to do. I didn't know if I was going to go back upstate New York and go back for my PhD, or was I going to go work into the ICU and get my experience there. When I graduated nursing school, I had no idea about being a nurse anesthetist. I never thought about being a nurse anesthetist. All I thought I just wanted to provide safe and effective care to patients, be holistic, and be there for patients and help them through the lowest point in their lives. Comment below about your experiences as an ICU nurse, and are you considering being an advanced practice nurse? When I finally decided that I was going to stay in New York because I had a sick father, I decided that, what will be best for me to work? At first, when I graduated nursing school, I wanted to be a psych nurse. I double majored in psych, so I got my nursing degree as well as my bachelor's in psychology. And I thought that these two degrees will guide me to become a psych nurse. Never having true psych experience, I always thought that I would want to be there for patients with mental disorders. So when I decided to finally land a job, I landed a job at NYU Medical Center in Manhattan, New York. The reason why I got that opportunity to work there, which was very competitive, but I remember my last semester in nursing school, during the summer, I was able to do a preceptorship in the ICU. And that was the opportunity that was handed to me. And I really liked the ICU, but I never really saw myself being an ICU nurse. So when I decided to go to NYU, the only job opportunity that was available to me was to become an ICU nurse. I really wanted to be a psych nurse. However, you have to have experience, at least 1 year of medical surgical experience at this institution in order to do that. So I said to myself, you know what? I could just go become an ICU nurse and then later on transition into psych nursing. Not realizing that the ICU was going to be my niche, my home, my love, my passion. At NYU, the great thing about working at this hospital, they had something called a residency program. So your first year, you had someone to guide you, be there for you. You had professors, you had clinical instructors, you had nurses in the ICU that would precept you. We had courses, we had didactics to basically guide new graduates into the world of ICU nursing. Going straight out of school and becoming an ICU nurse was one of the most difficult decisions I had to make. It was difficult, it was hard, especially just being a brand new nurse without any experience. However, it laid a foundation to my future. It was one of the most difficult decisions I made. It was a very difficult transition. However, I loved it, and I wouldn't have changed it for the world. When I was in the ICU, I was in a medical intensive care unit. I was able to jump around into the surgical intensive care unit, the critical care unit. I was able to go into the cardiovascular critical care unit. We were able to have a well-rounded experience in the ICU, which was great because it really helped guide me to become a CRNA. The great thing about ICU nursing is that you get to focus on 1 to 2 patients. You know them from head to toe. You know their whole journey through the hospital. You know from the minute they come into the hospital to when they get better and then they move forward into life. And I loved that because you really knew that patient. You were able to follow them. You actually were able to develop a relationship with their families, as well as you really knew the doctors, the intensivists, which was great because I was able to be a part of daily rounds. I was able to see my patients through the whole spectrum. I had very difficult cases, and I was able to see patients that couldn't go to regular hospitals. They all ended up coming to NYU for critical care management. The great thing about NYU Medical Center is a teaching institution. So you see everything, everyone's learning, everyone's growing, and I felt that that was a great environment for me to be in as an ICU nurse. Because when you decide that you want to go into ICU nursing, and if you do decide that you want to go into becoming a CRNA, or if you want to become a nurse practitioner, there's so much opportunities and growth that you can have as an ICU nurse. It gives you a great skill set that can never be taken away from you. I was involved in the code team, resuscitation committee. I was a recorder. I was a part of making protocols for the hospital in relation to the ICU. I was a champion in different endeavors in the hospital, and it really gave me that growth. Now, the great thing about working at NYU, within 6 months of you working, you can go back to school. You can get training and go to NYU school, which was nice because it was not that far away from the hospital. So of course I took advantage. After 6 months of being in the ICU, I said to myself, you know what, I want to go back into school. I want to get a degree. So when I finally decided that I was going to go back to school, I went back to school for an acute nurse practitioner degree. I saw myself being in a hospital. I saw myself maybe possibly being a nurse practitioner in the ICU. However, I never really shadowed an acute care nurse practitioner. I just said to myself, I'm just going to go back to school and I'll figure it out. And especially since it was free to go to NYU because you are a worker, you work at the hospital, it was a perfect opportunity just to grow. So as I was working in the ICU, I also worked part-time to get my master's. And I thought acute care nurse practitioner was going to be for me. I thought this would be an opportunity of a lifetime, that maybe I can work at the ICU, be a part of critical care management with patients. But deep down inside, it never felt like it was 100% of a fit. Because I remember I wanted to be a psych nurse, maybe a psych nurse practitioner at one point. And I was just going to school for acute care nursing, acute care nurse practitioner, because I'm an ICU nurse and this seemed like it was going to be a great fit. But it never felt 100%. So I remember when I was in the ICU, I met a lot of nurses. They were interested in becoming a CRNA, a nurse anesthetist, and I'm like, oh, what is that? I don't really know what that is. And they were like, yeah, you give anesthesia, you're in the operating room, you can be in multiple settings, and you could do tons of skills, placing epidurals, spinals, peripheral nerve blocks, central lines, intubations, starting all types of IVs and art lines, a whole suite of things. And you're so focused on pain management, which was something I was very interested when I was in the ICU with my patients. And I felt, wow, this would be really interesting to see what this might be a possibility, to see what this is about. So I took advantage of shadowing at NYU in the operating room, which was very easy because I was able to go downstairs to the operating room, speak to the person who was in charge, the chief CRNA, very welcoming, very nice, and I shadowed not just once, not just twice, multiple times, and I actually got to see nurse anesthesia in front of me, and I was just like, wow, this sounds amazing. And I said to myself, wow, I do a lot of critical care management in the ICU. We are part of intubation, extubations. We're very into arterial ABGs. We're into all different types of procedures, and we see a whole slew of patients with all different types of medical conditions, and really understanding pathophysiology. Also a part of drip management. All these different drips and titrating drips. And it kind of aligned in with anesthesia. You do all of that, except you're more focused on anesthesia management in the operating room. And I was like, this seems like a fit for me. And I loved the CRNAs were hands-on, very autonomous. And I said to myself, wow, this seems really cool. But at the same time, I was in a nurse practitioner school for acute care. And I was an ICU nurse. So I didn't know for sure what was going to happen with my life. when I was an ICU nurse. You know, was I going to continue and graduate? Because I was actually towards the end of my program, maybe a year left. And this was a stepping stone where I'm like, I don't know for sure what I'm gonna do yet, but I'm gonna figure it out. With shadowing, the CRNAs, I definitely have a video on shadowing. Definitely click the link above and you could definitely watch that video about shadowing. So just to let you know that my ICU experience was very broad. I got a wealth of knowledge and it definitely guided me into my path into becoming a CRNA. And these are just bits and pieces of the puzzle that I realized the love for critical care and then transitioning into becoming a CRNA. And now being a CRNA for many years, I love it. And I felt that everything happens for a reason. This is my daughter Kalea. So being an ICU nurse definitely was a great journey and I definitely recommend it to anyone. Maybe just to take, maybe if you maybe say to yourself, ICU nurse seems too difficult, seem very complex, very competitive. I would say just try it out because it's one of the main areas that you really get great training in critical care medicine. If you want to learn more about CRNAs, click one of these videos over here and I'll see you in the next video.